IFS has gotten so popular recently, this is a great moment to discuss whether the techniques it utilizes are safe. So let's talk about a few things. One, whether IFS is innately dangerous, whether the depth of IFS might ever be destabilizing for people in acute distress, and whether the critique that we haven't really studied the safety of IFS is totally fair, given that our field has not fully addressed the question as to whether therapy as usual is safe, especially since the data we do have on our evidence-based treatments is not completely reassuring in that area. There's a lot to talk about, so let's dive in. So is IFS a safe form of therapy? It's a question that has been sparked by an article that came out a few months ago that seemed to suggest if you try IFS, you will go insane. Now, when I saw there was an article about the dangers of IFS, I knew I definitely wanted to read it. In the end, the article was almost entirely misleading and dishonest, which we talked about in the last video. But I absolutely went in with an open mind. Why? Because I know it is possible for something to be both really powerful and healing on the one hand, but also carry risks on the other. The reason that was fresh in my mind is because just last year, I came upon a whole body of research as to the potential dangers of meditation. Now, I'm personally a big meditator and I've promoted meditation. So first I was a bit shocked that it can be harmful, but more importantly, I was shocked that I hadn't heard about this research. I was even a bit disappointed in my community because I'm a big believer that if we have data on something, we have to share it. In any event, I've been letting people know about the risks of meditation, which I'll outline at the very end in case anyone wants that information. But in doing so, I have not been intending to debunk meditation at all. There's a whole body of research showing its amazing benefits. So how is it possible for research to show two different pictures? Well, for one, there are many ways to approach meditation. But more importantly, meditation is powerful. And anytime something is powerful, it by nature must carry some risks. Think of it like this. If your doctor handed you a bottle of pills and said, "You really can't overdose on this. There's no wrong way to take it. Anyone can take it for anything, and really it can't ever be misused." You'd be thinking, well, does it do anything then? Okay, so why am I starting by talking about meditation? Really just to use it as an example of how even things we hold a simple narrative about are often complex. And we don't really do a great job, in my opinion, of making space for that complexity in public discourse. I've actually been surprised that there hasn't been like a hit piece about the evils of meditation that has gone viral. Because usually when something is popular, at first people will use it as clickbait in the sense of getting on the bandwagon. But then after that has been established, what's even more exciting and clickbaity is to debunk the popular thing. But that's all kind of silly. We don't want to idealize any path up the mountain or put it above critique. Nor is it really level-headed to be against it just because it's popular. Or worse, because it seems weird. Which brings us to the alarmist way this article was describing IFS techniques. I mean, they weren't really describing IFS techniques. They were describing something totally different, almost opposite, which is why I thought it was such an unethical article. But the implication was that parts work is so strange and imaginary that it will make you, one, remember false memories of abuse, and two, suddenly be split into multiple personalities. Now, we addressed the first concern in the last video. This is part 2 of the discussion on safety in IFS. So let's start this video with the question of whether IFS is at all likely to cause someone to develop multiple personalities. I mean, when I hear that particular fear, I admit I have a bit of an eye roll response. But let me get to why a bit later and first take it at face value. Because the truth is, I don't really know for sure that it could never happen, particularly for someone already leaning in that direction. I've never seen it play out that way. Of all the actual negative outcomes of therapy that my students consult about, that's never been one of them. And believe me, the concerns we supervisors do hear, we hear about repeatedly. The biggest one is probably emotional overwhelm, which we'll talk about later. That is something that comes up in therapy again and again, and therapists really have to be prepared to work with it, especially when it's paired with suicidality. But someone suddenly having multiple personalities? I've just never heard of that. So I'm guessing that's why it just never really got on my radar as a prominent concern. That being said, I have heard about therapies that look for what are called alters, which is definitely different than parts, but along the same continuum. And I've read reports that this can cause fragmentation. One of the researchers who specializes in harmful effects from therapy has a list of harmful treatments And he does put DID-oriented therapy on that list because of the risk of creating alters or multiple personalities by looking for them. But when I tried to do more research on this, I didn't find a lot of clear information out there. The truth is, the whole area of multiple personalities, DID, is just really hard to get clarity on. Whether DID, dissociative identity disorder, is even a real thing is an area of contention, although it is in the DSM-5, but how to work with it is just an ongoing debate. And I'm not informed enough to come down strongly on one side or the other. I just feel pretty confident that most people can relate to their parts without falling into greater fragmentation. But until we know more, it is probably wise to not try to do parts work with anyone with more severe psychological symptoms like psychosis or paranoia or compromised reality testing, or anyone you just sense is in a really fragile state and could probably use stabilization over inner exploration of any kind, as we'll discuss in the next video. Either way, I think if someone wanted to do research on this with an eye for nuance and clarity and safety, that would be great. The problem is, usually when someone expresses fear of parts work, or just suspicion that it may be pseudoscientific or all made up, it seems to me they're usually just having a knee-jerk reaction against the idea of parts work because it seems weird. Which brings me to why I generally have an eye roll around this concern. Because I'm someone who gets a little tired of weird automatically meaning bad. As a total aside, when I hear people question whether parts work might be this crazy, dangerous idea, it reminds me of people's first response to the emergence of the role-playing game D&D. Just to tell a quick story, when I was in 5th grade, I was sleeping over at a friend's house, and I remember her parents putting in this cassette tape for us to listen to as we fell asleep, and it was all about the dangers of Dungeons and Dragons. It went on to tell the tragic story of a boy who got so immersed in his character that he lost touch with reality. I don't know how I survived the 80s without being afraid of everything. But you probably can sense why I mentioned that story. Because I think sometimes we can just be so fear-driven that anything that seems weird becomes suspect. But shouldn't therapists at least be able to enter some of that weirdness with you? Particularly if we're actually wanting to engage the mind on its own terms? Because isn't the mind pretty weird? I think we all know that the responses our brain comes up with are not always perfectly normal or rational. And many of us believe that pushing them to always be normal and rational would not even be a sound goal. Now, I do realize it's a problem if we experience too much inner chaos. So let me describe how I think about it. I believe we're born complex. That's beautiful. But if we don't find ways to organize that inner complexity, in other words, to make sense of it, to put it into words, to find ways to map out potentially conflicting signals or needs or emotions or parts, then our inner world can fall into chaos. And I think people, including therapists, can get so afraid of that chaos that they aim for simplicity. But we aren't simple, and trying to be, or simply aiming to be more rational, will never be enough for us, I think. That being said, let me play devil's advocate on that a little bit. The truth is, I do think the IFS community perhaps over-reifies parts at times. To reify something is to make it real. Now, I understand why IFS therapists say that a part isn't only a metaphor. I actually do really get that, and it would take a whole other video to describe how it is that we can experience our parts as real in a way while knowing they aren't literally real. It's such a subtle thing, but let me give a quick example. Let's say I'm for the first time turning toward my inner critic with curiosity instead of annoyance or fear. And I say to it, I see you there, and I would really love to understand why you feel the need to berate me. Now, while there isn't literally an inner critic, I do feel that it's like a real relational moment, a moment of meeting in a way. But it isn't like we're meeting an actual entity or separate consciousness living inside us. It's mainly a way of meeting or more deeply understanding ourself or our mind, or at least a corner of our mind. Now, some people might experience parts as something even more real than that, and I'm not here to say that that's crazy or that they're lying. But for most of us, it will be plenty powerful, and maybe even safer, to be clear that we are entering an as-if mode. It's as if there's a little boy inside you who's scared of abandonment versus there's really a little boy inside you. Now, to be fair, the IFS Institute does not define parts as literal people inside us, not at all. But sometimes I just think we reify them a little too much in the way we talk about IFS. And while I've never seen evidence of that causing harm, I can't promise it might not for someone who's struggling with reality testing. And at the very least, it can make IFS seem a little weirder than is necessary, which isn't fair because we want people to benefit from it and not feel turned off by it. And while we're on that topic, let me add one more concern I have. There has been a swing over the last year or two to integrate some new agey ideas into IFS, not into the official training, but as a supplement. Now, for people who believe in energy and describe themselves as spiritual, this can be great. On the one hand, I have no judgment on that. I think people should be able to have a spiritual take on things, and that this could even add additional benefit when it's a fit. But if we make any of that too official, again, it's just risking pushing people away and can be confusing. When it comes to treatments that we want to be universal for anyone, we should have to be really careful that we aren't going past what at least can be explained scientifically, if not totally proven yet. In other words, the IFS experience is already a little weird. We don't want to push it. But again, I know it's hard to nail the right level of weird. If we let ourselves go full on weird, there could be negatives. But if we are allergic to any weird and swing in the opposite way, there can definitely be negatives to that as well. And let's explore that side a bit, with CBT as an example of maybe not weird or deep or complex enough. There is research showing that people often feel emotionally harmed by the fact that cognitive and behavioral approaches can at times feel too rigid and dismissive of deeper levels of suffering. In other words, limiting our experience to the cognitive and behavioral can actually be crazy making on the other end. I hear that described a lot. I frequently have people come to me feeling harmed by CBT because they really do have a lot of complex stuff going on inside, and when CBT doesn't really provide any good explanation around that, they end up just feeling kind of broken or crazy. I'll actually put in the description box below a study that interviewed 100 clients after receiving CBT, which is something, by the way, I think we should do more of, just actually asking clients about their experience of therapy, but that's an aside. This study did that, and 43% reported at least one adverse reaction to CBT, and 40% of those reactions were described as severe or very severe. Now, does that mean that I believe CBT isn't safe? Not really. That particular study was just one study, although there are some others that I'll put below as well. But here's the thing. Safety in therapy is not something we've, in general, done a sufficient job of researching. Unlike in psychiatry, reporting on side effects is not required by our field and is usually overlooked. So we don't really know what the picture is. We've been so gung-ho on proving therapy works, we've largely neglected this equally important question as to how often it does harm. Now, much of this lack of data is understandable. For one, even when deterioration happens, it's hard to tell what caused it. And if you ask people directly whether they felt any negative effects, kind of like the study I just mentioned, it could prime them to come up with negatives. So I don't mean to sound judgmental, but the reason I mention this is because when I hear people say we need studies to show that IFS is safe, well, I totally agree. It's good to remember that none of our other therapies have completely passed the bar on that either. I mean, in CBT, one of the main interventions is exposure therapy, a behavioral intervention that pushes people to do the thing they fear to do. That's one of our more risky interventions. That being said, even humanistic therapies, which you would think would be the safest possible approach because a therapist doesn't push at all, even then, clients have reported feeling disturbed by the lack of response and guidance from the therapist. In any case, while I do believe we should do research into the potential side effects of IFS, I also wanted to put that in context to give a fair picture. Okay, so we've addressed some of the specific concerns people occasionally bring up around parts work. In the next video, we will address what I believe is actually the most common risk in doing parts work, or really any deep inner exploration, and that is around emotional overwhelm. Alongside that conversation, however, I will give my argument for why I believe IFS, given its depth, is impressively safe and just really respectful of the client's inner world. But wait, I promise to come back at the end here and summarize the risk factors associated with meditation. First, I want to reassure you, if you are doing a gentle mindfulness practice at home, maybe for 30 minutes or so, we don't have any reason to think that is particularly dangerous. The danger comes when people push past their inner signals of distress. In other words, when something is starting to feel off and they ignore that and just keep going, which in meditation some people can do for hours. Unsurprisingly, the people at highest risk are the ones who have both underlying unresolved trauma and who've dealt with it through being really high achieving and hardworking. So maybe they decide to go on a silent retreat and are just going to do the best job of meditating. But again, if they push past their inner signals because they're trying to achieve something, in IFS we would say it's an achieving part versus just their self who's doing the meditating, then trauma stuff can start coming up in ways they aren't prepared for. For some, there's a sense of their ego dissolving, but not in a good way, and it can be a bad situation. By the way, if that's happened to you, there are really good resources at cheetahhouse.org. You can find all the research there as well. And for whatever it's worth, the dangers of meditation are about the same as therapy, maybe 5 to 15% of people experiencing harm. Okay, so let me end with one final point. When I read about the dangers of meditation, I thought, oh, that's why we need to get the word out about IFS, because it's literally training in how not to push through our inner signals, but rather respect and understand them. In that sense, IFS might be a way to make all of our growth endeavors, and health endeavors, and political endeavors, and relationship endeavors just safer. I'm Dr. Tori Olds. I hope you got something useful from this conversation, and I hope you will stay with me for those to follow.
Welcome, friend, come inside.
Hey guys, thanks for watching. If you found this video interesting, I would love if you shared it with a friend or a colleague. And if you're enjoying my channel, it would mean a lot to me if you could like or subscribe.